Hi everybody, Dr. Cary Yurkiw here. Thank you for joining me for this live webinar called Relief Techniques for Neck and Shoulder Pain. And when we have somebody come into the clinic with neck and shoulder pain, we want to first assess their condition. So we want to see basically what's causing their neck and shoulder pain. And secondly, we want to do treatments. We want to help them with their condition. And then last, we want to give them recommendations for home. So I'm just thinking about today's schedule. I had a new patient come in with neck pain, and she's a nurse at the hospital, and she kinked her neck by looking up, and something pinched in her neck, causing spasms and pain. I had a patient returning after about 4 months, and he turned his head and he felt something shift in his neck at C2, the second vertebrae, and then that caused a lot of pain for him and kind of locked up his neck. So I'm just thinking of a couple people that came in today with neck pain. Now sometimes the neck pain can radiate down into the shoulder region because the nerves from the neck travel down into the shoulder. So I'm going to talk about the shoulder today as well, and how it's connected to the neck, and then some things you can do to help yourself. So I'm just going to advance the slides here. If you guys have any questions on YouTube, please ask here. So ask questions here, and I'd be happy to answer those for you. Okay, so now I'm Dr. Cary Yurkiw, and I practice at Tut Street Family Chiropractic here in Kelowna. And this is my 30th year of practice. So initially, I wanted to become a chiropractor because a chiropractor helped me with my knee pain. And I was just a teenager at the time and suffered from knee pain. My father took me to a chiropractor. He assessed my knees, took x-rays, found the problem, and then did treatment to help my knees. So that made a big difference in my life. And from that point forward, I decided I wanted to become a chiropractor. Here I am 30 years later in practice. I went to school in Toronto. I'm from Winnipeg originally. Went to the University of Winnipeg for pre-med. And so, you know, for a long time now, I've wanted to be a chiropractor, and I've been practicing chiropractic, seeing people with knee pain. In fact, today I had a athlete. She's a soccer player. She's a teenager, and she actually had a hamstring pull that was causing her hips to shift. And I did treatment for her to help her hamstring and the alignment of her hips. So I guess I'm fulfilling that vision that I had so many years ago about helping other people like me that were suffering from knee pain and that type of condition. And today I'm going to talk more about the neck and shoulder, and I'm going to talk about how we diagnose these conditions. So for the neck and shoulder, what are some common causes? Well, some causes are sleeping incorrectly. So sometimes when people sleep in a bad position, they'll kink their neck. I don't know if you've ever woken up in the morning with pain in your neck. Maybe your neck's off to the side. It's hard to turn your head. It's because you slept in a position that pinched the nerve. Some people have conditions like whiplash. They get in a car accident. I saw that today at lunchtime, where there's a rear ender. Someone hits you from the back, your head whips backwards and forwards, and then that causes whiplash. Some people have poor posture. You know, they're looking down a lot, whether it's text neck, looking at their phone, maybe their desk is set up too low. Today my desk is actually set up quite high for this webinar. So we have a standing desk here, and there's three settings. I have it on the high setting just to be able to do the webinar. But you want your monitor at eye level, and you want to be able to look down a bit, but you don't want to look down too far so that your head's always flexed forward. Similarly, when you're typing on your phone, you don't want to be looking down too much into your lap, because that's going to cause misalignments in the neck area, cause tension in the muscles, can lead to things like neck pain, headaches, and shoulder pain. Now the symptoms when there's a pinched nerve, it all depends on where the pinched nerve is. Now the top two nerves in the neck, they travel up around the head to the top of the eyes. So these are the greater occipital and lesser occipital nerves. These nerves can cause headaches, pain that radiates around the eyes or even into the face and the ear region. So if you have a misalignment at C1 or C2, what we can see is headaches or facial pain from a pinched nerve in that region. Now, if it's lower down, C3, 4, 5, 6, 7, and 8, those nerve roots travel down into the neck region, down to the shoulder, and down your arm. We call that the brachial plexus. So if a nerve root in the brachial plexus is pinched, it can cause pain that's local in that spot, but it can also cause pain that radiates down your arm. So sometimes you can have pain that's right down to the fingers, like numbness and tingling in the fingers, pins and needles, that type of thing. So you really want to first identify what's causing the neck pain, what's causing the shoulder pain, where it's located, where it's coming from, and then we want to treat that area. So the treatments for neck and shoulder pain, very simple types of treatments, and I'm going to talk about that in a second here. And when we do treatments to the neck and the shoulder, we want to do hands-on adjustments. We do instrument adjustments. Sometimes we use the tables, and sometimes we use something called the Y-strap or traction for the spine in conjunction with the adjustments. Now here I was talking about posture. Well, what is good posture versus poor posture? And when you look at the body right to left, you should see the head nice and level, shoulders level, hips level, leg lengths equal, and then arm lengths equal. And when we see a short arm length, so one hand's shorter than the other, when we see one leg shorter than the other, that's an indication that there's a problem with the general alignment of the body. So I like to start off my checks by checking the leg length, checking the arm length, checking the alignment, the range of motion, finding out exactly which area is causing the pain, and then addressing or treating those causes of the poor posture. Some common postural mistakes that people make are slouching or having their head too far forward, like we talked about earlier, sitting at the desk or text neck when you're texting. And often what I'll give patients is ergonomic adjustments to change their desktop setup so it's more centered, so that if they have multiple monitors, it's centered and they're looking to the right and to the left side, so they're not don't have a predisposition to one side. And then the position of the mouse and the armrests on the chairs, and if they're using their phone, just having the phone up in front of them rather than too far down. So I'll make some simple postural correction adjustments for the patient in conjunction with the work I'm doing here in the clinic. As I do my treatments, I give the patients some stretching techniques to take home with them, because as they start feeling better, we want the patient to maintain the changes that we're accomplishing in the clinic. So I often say to people, it's like 2 steps forward, 1 step back. And as we progress through the treatments, we want the patient to start supporting the work we're doing in the clinic. So some neck stretches, just some general ones like this one, the dog and the cat, can be very effective. These are yoga positions that I tell patients to alternate between the dog and the cat 8 to 10 times, just feeling the flexion and extension of the neck as the alignment improves. Some shoulder stretches. Sometimes I give patients wall angels. They're like snow angels, but they're done against the wall to help with the posture of the upper back, just sliding the arms up and down the wall as the person's standing against the wall doing that wall angel. And I usually give 8 to 10 repetitions of these exercises first thing in the morning, just before bed, and I just start the patient off with 1 set, and then we progress to 2 sets and 3 sets as the patient gets more comfortable with these stretches. In addition to stretching, strengthening is important. So as we realign the posture and the neck area, we want to make sure we strengthen this area so it doesn't go back out of place again. So with strengthening, we want to do things like planks like this. Front planks, side planks. We want to give patients some exercises in the gym. Could be isometrics for the neck. It could be shoulder shrugs, resistance bands, that's going to help to strengthen the neck and the shoulder. We want to make sure that patients are doing these exercises correctly, because if you do the exercise wrong, you could pinch a nerve and that could set us back. So I'm always giving my patients some advice on doing strengthening exercises for the neck and the shoulder region. Also, some things you can do to help with the pain and discomfort is you can use heat or cold. Now, generally, I'll give patients instructions to use cold at the beginning. First few days, put ice on the area, get the inflammation or swelling down, and then as that swelling goes down, then we'll work with heat to increase the range of motion and the flexibility of the muscles. So in an acute condition, using ice is better than heat. Then after a few days, we switch to heat. Some massage techniques, some things you can do just to massage the muscles or use some products on the muscles. Things like Tiger Balm can be very effective as it heats up the muscle and relaxes the muscle. There's some other products that are behind me here in what we call the store that can really help you with relaxing the muscles, including something like a massage gun to help vibrate the muscle, increase the flexibility of the muscle, get the toxins out, like the lactic acids, out of the muscle. And then over-the-counter remedies, often when people are in a lot of pain, I'll tell them to go see their pharmacist, talk about some anti-inflammatories, talk about some painkillers. Generally, I don't recommend muscle relaxers or anything like that, because when the body's trying to protect itself, we don't want to relax the muscles and potentially cause more harm or an injury to the nerve in that area. So I tell patients not to use muscle relaxers, but go and talk to their pharmacist about anti-inflammatories and painkillers. Now, when we look at ergonomics of the workstation, the head should be level with the top of the monitor. You should look slightly down. I would say 20 to 30 degrees of looking down is fine. It's important to have armrests on the chair because you want your shoulders and neck to relax. You don't want your arms pulling your neck and your shoulders down, causing a pinched nerve in the neck and the trapezius area. So armrests are important for the chair. And then you want your mouse to be level, the table level, to be fairly level with the armrest, because you don't want too much of an up angle or down angle to your desk. And this workstation setup, very important for your daily habits. Feet should be flat on the ground, resting comfortably, and you should have a cushion or your thighs supported so that you're not overextending the knees, causing pain in the lower part of your spine. Now, I tell people to switch positions about every 30 minutes. So if you have a standing desk, switch from sitting to standing for about 30 minutes, then go back to sitting again. Switching positions, very good for the blood flow and the circulation in the legs and the arms. So we really do need that circulation, especially now that we tend to be sitting more at a computer than 5, 10, 20 years ago. The more tools and accessories you have to help support the alignment of your head and neck region, the better. Sometimes I'll talk to patients about their car setup. So just having the headrest in the car supporting the back of their head. I did have a situation this week where one of my patients had the angle of the headrest too far forward, stretching the neck as they were driving for a very long distance. I think they drove about 8 hours. And that caused a lot of tension in the upper neck, triggering a migraine. So we don't want people with the headrest too far forward, too far back, not supporting the head in that neutral position that you see here on my slide. So the ear, shoulder, hip should be lined up when you're sitting, and then the hip, the head, the ear, shoulder, the hip, and the ankle should be lined up when you're standing as well, and that's very good posture. Now, the next slide here, I'm talking about holistic approaches to pain management. So some things I like to talk about in the clinic are stress reduction. Stress can cause lots of tension in the neck area, can kind of build up here and in your shoulders. A lot of people say when they feel stressed, they kind of tighten up like that in a defensive posture. So if you feel it like you're tightening up, holding yourself kind of stiff, it's important that you practice some stress reduction techniques. As some of the stress reduction techniques can involve stretches and exercises, but also addressing the cause of the stress and doing some breathing exercises, some meditation can be very helpful in reducing stress. Then sleep and recovery, that's so critical. And especially when you're in a lot of pain, you need some extra sleep and recovery. I tell people to sleep on the pain-free side. So if you have pain on the right side of your neck, sleep on the left side or sleep on your back. That'll just help to prevent the nerve from getting pinched on the painful side. The other thing that I like to tell people is to get the right pillow. Proper pillow will support the proper curvature in your neck. Now initially when you come in and your neck is kinked and you have, if you have too much pressure on one side, that'll cause, that'll result in you not being able to get the right pillow to support your neck. So as the treatments progress and the alignment improves, then you can put a pillow in to support the normal curvature. So initially when you start care, buying a good pillow for your neck may not be the right thing to do, but as the care progresses, then getting the right pillow is going to be important because you're going to have the proper alignment of the neck. I hope that makes sense. But I often tell people to wait for a few visits until they get the proper alignment back in their neck, then they can get a pillow. For nutrition and hydration, very important. In fact, this week I did an Instagram reel and YouTube short on drinking enough fluids. You need about 8 to 10 glasses of water a day. And I usually recommend electrolytes. And we carry electrolytes here in the clinic because that gives you the right salt concentration, potassium, and then that's going to help you to hydrate the tissues. During the night, the discs will absorb about 1/3 of their height. So it'll absorb water and expand. And as the discs expand, it'll take pressure off the nerves because the nerves come up between the bones where the discs are. So drinking enough water is important. Getting the right amount of electrolytes, very important for the spine and the health of the spine and the discs. Okay, now if you guys have any questions, please ask me here on YouTube or on Instagram. My phone might die in a few minutes on Instagram, so now's your chance to ask some questions. And if it dies, I apologize, but I have about 6% battery power left. And oh, somebody's saying that my slide's not advancing here. Okay, let me see if I can get the slide to advance right here so you can see that. Oh, sorry guys. Okay, I'm gonna go back to understanding neck. Okay, so you guys may not have seen these slides. Can you let me know if the slides are advancing now on YouTube? Huh. The slides were advancing on my end, but they may not have been on your end. Okay. Yeah, so hopefully you guys saw my slides, but I'll quickly review the slides with you. So this was my first slide right here, understanding neck and shoulder pain. The next slide that I showed the audience was importance of posture, good posture versus poor posture. And here on this slide I showed the proper alignment of the body, straight down the middle, shoulders level, hips level, head level, and then the ear, shoulder, hip, and the ankle lined up. I talked about stretches in the webinar. I talked about the cat and dog. These are stretches you can do at home to help support the alignment of the neck and shoulder. I often tell people to alternate between the cat and the dog, going back and forth 8 to 10 times, and usually holding it for 1 to 2 seconds at the top of the range of motion and at the bottom of the range of motion. Very important for the proper stretch. I tell people to do this first thing in the morning and just before bed. I talked about strengthening exercises. This is very important as the alignment of your body improves. So doing strengthening exercises to keep the bones in alignment, to strengthen the body so it doesn't shift back into the old posture, very important. This one on this slide is a front plank, but I also talked about doing side planks on your side, very important for the side muscles or the lateral muscles in the neck and shoulders. I talked about hot and cold. I generally recommend cold first, and I tell people to do that for the first few days when they have a pinched nerve, get the swelling down. Then I tell them to use heat. Heat to soften the muscles, to improve the flexibility of the muscles. And then I talked about different techniques that you can use for your muscles, both using products like Tiger Balm right above me right there, and also like a massage gun is good to relax the muscles. Stretching, some heat or warmth is good. And then I talked about over-the-counter remedies. Some of them are natural that we have here in the clinic. Sometimes I recommend talking to a pharmacist for anti-inflammatories or painkillers. But generally I tell people don't use muscle relaxers. Muscle relaxers at the beginning when you're in a lot of pain, not a good idea because it relaxes the muscles and it can pinch the nerve further. So I tell people not to do that, but talk to their pharmacist. I talked about ergonomics in the webinar. So your workstation setup, having your monitor at eye level, matching up with the top of the monitor, looking down about 30 degrees at the maximum so it doesn't strain the neck too much. And then making this part of your daily habit to sit at a desk with some armrests, with the mouse parallel to your armrest, but also switching it up. If you don't have a standing desk, consider getting a standing desk because they're not that expensive and they're really great because you can stand up for 30 minutes, you can sit down for 30 minutes, and you can alternate positions, which improves the circulation in the arms and the legs. Also, any tools you can get, like a headrest, and adjusting the headrest in your car, very important for proper support of the head and neck region. I talked about holistic approaches to pain management. This includes stress reduction because a lot of stress and tension can build up in the neck area, especially the upper part of the neck. When you get tension in the upper neck, it can cause headaches. And I shared with you that this week I had a patient that had migraines because she was traveling a long distance in her car, but her headrest was tilted forward, stretching those muscles and overworking them underneath the skull. We call that the suboccipital muscles. And if those suboccipital muscles get strained, that's where the nerves come out that go to the head and neck region and can cause headaches. I talked about sleep, getting some extra rest, especially if you have pain. Sometimes people need to take some naps. So if you're not sleeping as very well during the night, I encourage people to take a nap or two during the day because sleep is cumulative, meaning if you're not getting 8 hours of sleep, let's say you're getting 5 or 6, you need to get 2 or 3 hours during the day to kind of make up for it. So it's like a bank account. Sleep adds up over time and you don't want to be deficient. I talked about nutrition and hydration, how important that is for the discs during the night because the discs actually suck up nutrition from the surrounding environment. We call that imbibition. So the discs imbibe the fluids around the disc and they can swell or expand, and that's what we want because then it opens up the spaces between the bones for the nerves and you're going to feel a lot better. So drinking 8 to 10 glasses of water and taking some electrolytes, very important. Potassium, sodium, chloride, magnesium, very important ingredients for you to help with spinal conditions. And then in conclusion, we talked about things you can do to help yourself, how chiropractic care works to do adjustments to realign the spine. We do hands-on adjustments, we do instrument adjusting. I use the Y-strap to traction the spine in the clinic, all very important techniques to realign and improve the range of motion. But I also do shockwave and laser in the clinic. Those are soft tissue treatments that can really help with the neck and shoulder muscles as well. Now, if you're in the Kelowna area, don't hesitate to give us a call. You can call our phone number, 250-486-0062. So I'm just going to put that number right here in the chat. So feel free to call our number if you have any questions or you want to book an appointment. You can also go to our website, and our website is Tut Street Family Chiropractic. I'm going to put that in the chat as well. So right here. But you can also go to the link in the bio if you're on Instagram, and there's a link going directly to our website as well. If you're on YouTube, feel free to click on that link right there that I just put in the chat. If you're not in the Kelowna area, you can reach out to me. I'd be happy to find you a chiropractor in your area that does the type of work that I do. So I will refer you to a chiropractor. We do bill directly to insurance, including ICBC. We do bill to Sun Life, Manulife, Canada Life, all of the major insurance companies, about 25 of them that we bill directly to. And no doctor referral is needed to come and see us. So you don't have to have a doctor's referral. Often we can see patients the same or the next day. We had a nurse today come in, same day appointment, because she kinked her neck. So often we see people the same day or the next day, and we're open 7 days a week. So very convenient hours, very convenient schedule for people to come and see us. Now, if you're interested in coming to future webinars, I've been doing quite a few lately. I'm just going to take this slide down, and hopefully you can see my next image right here. And this is our site on Eventbrite. So if you go to our Eventbrite site, what you're going to see is the upcoming webinars. So today we did the relief techniques for neck and shoulder pain, but then on May 23rd at 12 noon, this is going to be part of our Lunch and Learn series. I'm going to be talking about alleviating pain in the lower limbs. So I'll be talking about what you can do for leg pain, shin pain, foot pain. So we'll be talking about those conditions Thursday next week at 12 noon as part of our Lunch and Learn series. Then down the road, I have these webinars coming up. I won't go over all of them today, but if you go to our page on Eventbrite, Tut Street Family Chiropractic, put in Dr. Cary Yurkiw, you can follow us by clicking this button right here, and then you'll see all the upcoming events, and Eventbrite will actually send you an email when there's a new event that gets posted. So I hope you follow us on Eventbrite. You can also click on the link in the bio on Instagram, and that'll take you over to our Eventbrite page. So that's pretty easy to do there. Now I want to thank you guys for joining me tonight. Sorry for the technical glitches. I know the audio was a little bit low on Instagram, so I corrected that with the microphone. And then someone on YouTube said that the slides weren't advancing. I went back, just reviewed those slides and advanced those slides for you. So thank you for your patience with some of those technical glitches. I hope you guys have a good evening, and I will talk to you soon.